Hello everyone, am I audible so that we can start the session? So let me just check with the students. Okay, so am I audible? Okay, so yes, let's start with the session now. So this is a session in which we are going to discuss the important MCQs targeted for the NEET MDS exam 2026. So these are all important MCQs from the previous years, and let's discuss one by one. So I'm just checking. Okay, good evening. Good evening, Dr. Subha. Good evening, dear. Okay, everything is fine and we can start the session. Okay, good evening. Good evening. So first of all, best of luck for the upcoming session, and let's revise important 20. So I have targeted most important 25 MCQs from the previous year, which is very important for you to revise before the examination. Yes, good evening, dear. Good evening to everyone. Good evening. Yeah. So which anatomical structure is passing through the structure marked with black arrow? So you can see this is exactly the green color structure which you are seeing, which is connecting this thyroid cartilage, as you can see in the image, with that of hyoid bone. So what is this membrane? This membrane is thyrohyoid membrane. So you have to identify the thyrohyoid membrane, and it's very easy to identify. It is showing you the skeleton cartilaginous framework of the larynx, and you can see the thyroid cartilage is connected with hyoid bone. So there you can see there is one nerve and one artery which is passing through this structure. So can you name which is the structure among A, B, C, D which is piercing the thyroid membrane? Sure. I have also given the list of important examination topics in the group of Telegram group, but I will definitely, while ending the session, before just ending the session, I will give you the list. Sure, I will give you the list, my dear students. So if we are talking about the structures piercing, so this structure which you are seeing is the internal laryngeal nerve. So now you can see the same image with the labeling has been shown to you. So very nicely you can see the blue color structure here is cricothyroid ligament, and the green black colored arrowed structure is the thyroid membrane, and two structures are piercing it. One is the internal laryngeal nerve and the other is superior laryngeal artery. Okay, now coming to the next MCQ. All are the symptoms of facial paralysis except loss of salivation, loss of lacrimation, facial muscle paralysis, loss of taste sensation in posterior 1/3 of the tongue. So basically this is an MCQ targeted with the two topics, the tongue and that of facial nerve. Facial nerve is a very important topic for all the students. I want you to know about facial nerve origin, course, facial nerve nucleuses. You have to know about the branches and clinical anatomy. So loss of salivation, yes, it happens in facial nerve injury. Why? Because we know that via facial nerve, the innervation is given to some mandibular and sublingual glands. So their secretion will be affected. Loss of lacrimation is because of lacrimal gland. So this is due to SMG and SML, that is sublingual and submandibular gland. Lacrimation is due to lacrimal gland, and obviously facial muscle get paralyzed where Bell's palsy is seen when there is lower motor neuron palsy and one half ipsilateral side, and when there is upper motor neuron injury, then the contralateral one quadrant of the face is involved. Upper half of the face escapes the injury because of bilateral corticonuclear fibers. So basically the right answer is loss of taste sensation in posterior 1/3 of the tongue. And we know, yes, obviously everybody has given the right answer. And the reason is because of posterior 1/3 of the tongue along with circumvallate papillae is supplied by which nerve? The answer is it is supplied by 9th cranial nerve, that is glossopharyngeal nerve. So see this image where you can see this is an enlarged. I would like to enlarge this image where you can clearly see if we are talking about The motor supply, all the muscles of tongue is supplied by which nerve? Hypoglossal nerve, the 12th cranial nerve, except the palatoglossus muscle, which is supplied by vagus nerve carrying the fibers of cranial part of accessory. When we are talking about the sensation, general sensation of anterior part of the tongue, it is via lingual nerve. General sensation means sensation of pain, touch, temperature, and taste sensation is via coda tympanic branch of facial nerve. The posterior 1/3 of the tongue along with the overlap. What is these? These are circumvallate papilla, which is lying just anterior to this sulcus terminalis. So there is an overlap of nerve supply, and not only the posterior 1/3 part of the tongue, also the circumvallate papilla is innervated by 9th cranial nerve, the glossopharyngeal nerve. The posterior most part of the tongue is getting innervation from internal laryngeal nerve. Okay. Now coming to the next MCQ, that is question number 3. Let me discuss it. A patient has pain on turning the neck to the left side and chin deviate to the right when he tilts the head to the left side. Okay. Which muscle is involved in this movement? Whether the platysma muscle, anterior scalenus muscle, or the trapezius or sternocleidomastoid muscle. So this is again a very important question in which you have to know the action of this muscle. So this particular action which is mentioned in this MCQ, that is turning the head to the same side and rotating it to the other side. Actually, this happens. So basically, if I am talking about this turning the head to same side, yes, sure, after the end of the session, the Telegram group link will be provided. Don't worry, Telegram group link will be provided. Okay. So now if I am talking about turning the head to the same side and rotating into the contralateral side, this action is done by the sternocleidomastoid muscle. So again, this is an action of sternocleidomastoid muscle. Actually, when you will see the posterior triangle of the neck, so this is an image where you are seeing the posterior triangle of neck, and posterior triangle of neck has got the boundary. So it is bounded anteriorly by sternocleidomastoid muscle. This is and posteriorly by trapezius muscle. So in this you can see a nerve which is passing here is the accessory nerve. So which nerve you can see here? This is the spinal accessory nerve, which is located in between the two muscles, sternocleidomastoid muscle anteriorly and trapezius muscle posteriorly. The accessory, spinal accessory nerve is giving innervation to that of sternocleidomastoid and trapezius muscle, and it is innervating sternocleidomastoid muscle and trapezius muscle. Now sternocleidomastoid muscle was mentioned in the MCQ, and if I talk about trapezius muscle, its action is shrugging of the shoulder and retraction of the shoulder, and it also helps along with serratus anterior muscle in overhead abduction of arm. Okay, let's move on to the next. Injury to Pterion. So basically lateral aspect of the skull is containing H-shaped suture, and this H-shaped suture is Pterion, where 4 bones are meeting, that is the frontal, the parietal, the we have got the also we can see the squamous part of the temporal bone. So I would like to show you that image, and basically at this location we have got middle meningeal artery, which is a branch of first part of maxillary artery, along with one more structure. Can anybody name? Also the location deep to this location we have got the lateral sulcus stem, that is sylvian fissure of the brain. So here you can see the parietal bone, the frontal, this temporal sphenoid are meeting at a H-shaped suture, that is Pterion, and the anterior division of middle meningeal artery is located there, and there is bleeding from this artery leading to the arterial blood collection and causing the extradural or epidural hematoma. Okay, now coming to the next question. Not a branch of third part of maxillary artery. Which of the following is not a branch of third part of maxillary artery? So maxillary artery, actually if I talk about the blood vessels of head and neck and also brain, it is very important that you should be knowing about all the muscles, all the branches of maxillary artery. So when I am talking about maxillary artery, it's a terminal branch of external carotid artery, and maxillary artery is divided into 3 parts. It is divided into 3 parts by divided in 3 parts by lateral pterygoid muscle. So when I am talking about lateral pterygoid muscle, it will divide the maxillary artery in 3 parts, first, second and third. And it is very important for you to know the individual branches. So if I'm talking about not a branch, the answer is anybody? Yes, supraorbital is absolutely right answer, because it's a branch of ophthalmic branch of it's a branch from ophthalmic artery, which is a branch of internal carotid artery. Sphenopalatine, the greater palatine and infraorbitals, all these are the branches of third part. Very nice. Pick pass is the mnemonic for the branches. I want everybody to go through the branches from the first, second and third part. How to memorize this? Branches from the first, second and third part, very easy. Branches from the first part of maxillary artery is, the mnemonic is Damia or Mada. D-A-M-I, Damia or Mada. D for deep auricular, A for anterior tympanic, M for middle meningeal, A for accessory middle meningeal, and I for the inferior alveolar artery. All muscular branches from the second part, masseteric, buccal, and pterygoid and temporal. If I am talking about third part branches, that is pick pass. So there is posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery, artery to pterygoid canal, and sphenopalatine artery. So please do know the mnemonic and know the branches of individual part of the maxillary artery. Very, very important, my dear students. Okay. So yes, official Telegram site has been already given to you, and also at the end I will tell you to be the part of the test series of the DBMCI MDS platform. That is very important for you. Now coming to the sixth question, not true about trigeminal nerve. Which of the following is not a true statement about trigeminal nerve? Option A, ganglion lies at the apex of petrous temporal bone, supplies muscles of mastication, supplies all maxillary fluid, origin between pons and medulla. So basically for this is a question of neuroanatomy part, in which you have to know about trigeminal nerve. So the location of ganglion, so we have to know which is not correct. Ganglion, trigeminal ganglion is lying in the Michel's cave, and it is located the apex part of petrous temporal. So this is a correct statement. Muscles of mastication, obviously the mandibular branch of trigeminal nerve gives innervation to all the muscles of mastication, masseter, temporalis, medial and lateral pterygoid. If I talk about supplying the maxillary teeth, so obviously the maxillary branch of trigeminal nerve supplies the upper teeth, that is maxillary teeth, and the lower teeth, that is supplied by mandibular branch of trigeminal nerve. Origin between the pons and medulla is absolutely incorrect. Why? I will tell you. Actually, when I am talking about pons ventral aspect, from the ventral aspect of pons, the trigeminal nerve emerge, both the sensory and the motor component, not from pontomedullary junction. If I talk about pontomedullary junction, just a quick revision. Pontomedullary junction. So if I am talking about pontomedullary junction, the nerves which is traversing from medial to lateral will be 6th cranial nerve, the 7th cranial nerve and 8th cranial nerve. Actually the 7th cranial nerve, both the branches, that is the motor and sensory branch. So basically if you will see the sensory component of the facial nerve, it is sandwiched between the vestibulocochlear nerve and that of the motor branch of facial nerve. So only the sensory component of facial nerve is called as nervus intermedius, or it is also called as the Brisberg nerve. So many names are given to these nerves. So basically the correct statement, which is the incorrect one, will be the origin of trigeminal nerve from the junction of pontomedullary junction. That is incorrect. It is from the ventral aspect of pons. Now, I just want you to see this trigeminal impression. This is the location of trigeminal nerve apex. This is the trigeminal ganglion. This is the apex of petrous temporal bone, which is showing you the location of trigeminal ganglion, which is at the petrous part of temporal bone. And here I would also like to show you that from the pons, we have got the sensory and motor component of trigeminal nerve emerging out. Actually, trigeminal nerve is having motor component and it is having a sensory component. So if I am talking about mesencephalic nucleus of trigeminal nerve, it has a function of proprioceptive sensation, and the main sensory has got a function of touch, fine touch. And if I am talking about the spinal nucleus, it has got a main control of pain and temperature sensation, and motor component of trigeminal nerve is giving innervation to muscles of mastication. I would also like to show you this image. Yes, good evening everyone. If you will see the sensory and motor component, here the trigeminal ganglion, which is located at the petrous part of temporal bone, which was a correct statement. It has got 3 divisions. The ophthalmic division will go or traverse through superior orbital fissure. The maxillary will traverse through foramen rotundum, and the mandibular division of trigeminal nerve will pass through foramen ovale. These are the foramens located in the middle cranial fossa. Okay. Now, which muscle is supplied by Ansa cervicalis? Okay. Okay. Ansa, sir, the next important question, which is it's very, very important for you related to anatomy, is the Ansa cervicalis. So, which muscle is supplied by Ansa cervicalis? Okay. So, actually, Ansa cervicalis, if I am talking about Ansa cervicalis, it is a nerve loop. Okay. And this nerve loop is embedded. So if I am talking about the nerve loop, it is embedded in the anterior wall of carotid sheath. Okay. Okay. So if this is exactly very important for you to know that if I am talking about Ansa cervicalis nerve loop, it is formed by cervical nerve. So it is formed by C1, C2 and C3. Actually, C1 is passing the forming the superior root of Ansa cervicalis, and C2 and C3 are forming the inferior root of Ansa cervicalis, and this nerve loop is embedded in the anterior wall of carotid sheath. It gives innervation to infrahyoid muscle. Okay, it gives innervation to it is actually giving innervation to infrahyoid muscle, and it gives innervation to all infrahyoid muscle except one. Can you name it? Can you name it? Can you name it? Okay, can you name it? Okay. Yes, sternohyoid, sternothyroid and omohyoid. So definitely omohyoid is the right answer. Okay. Omohyoid is the right answer. Okay. So yes, a student has told me assess for genitive procedure that is done for trigeminal neuralgia. Okay. So that is a procedure for decompression surgery. Okay, that is decompression surgery. Now coming to this nerve loop, can you see here? Here we can see this is the inferior root of Ansa cervicalis, and this is the superior root. Okay, so when I am talking about the superior root of Ansa cervicalis, this is formed from C1. It is formed from C1 nerve passing through hypoglossal nerve, and inferior root of the Ansa cervicalis is formed from C2 and C3, as you can see in this diagram, and this is lying anterior wall of carotid sheath. That is means it is lying anterior to the carotid artery, internal jugular vein and vagus nerve, and it is giving innervation to sternohyoid, sternothyroid, omohyoid. And thyrohyoid is the muscle which is also infrahyoid muscle, which is not supplied by Ansa cervicalis loop. It is supplied by C1 nerve fibers running along with the hypoglossal nerve. Is it okay? Stylopharyngeus, no, stylopharyngeus is the muscle of pharynx. Okay, now coming to the next, you have to know the location of danger space of the neck. So in this question, neck space bounded anteriorly by alar fascia and posteriorly by prevertebral fascia. So that is very important for you to know. So you can just mark this correct answer. So there is two important things which you have to mark. Prevertebral space, alar space, danger space. The right answer is danger space, and I just want so I just want you to see this image where you can understand the retropharyngeal space boundary, and also that of, you should also know that of danger space. So the red color space which you are seeing is the danger space, and anterior to the red outlined space is the retropharyngeal space. So when we are talking about retropharyngeal space, it is bounded posteriorly by alar and anteriorly by buccopharyngeal fascia. So if you want, I can use different colors so that you are not getting confused. Retropharyngeal space is bounded, it is between bucopharyngeal fascia and alar fascia, and danger spaces between alar fascia and prevertebral fascia, that is shown in red color. Okay. Now coming to the next question, motor area 4 is located. So in this question you have, so basically important areas like visual areas, auditory cortex, primary motor area, primary sensory areas, for motor Broca's area, speech area, sensory speech area, Wernicke's. These are important locations which you have to know. Functional area number and where it is located. So motor area 4 is located where? Yes, absolutely correct answer. It is located in pre-central gyrus. So actually, if I am talking about post-central gyrus, that is the location of primary sensory area 3, 1 and 2. So yes, very right. So you can see the sensory area 3, 1 and 2. It is located in post-central gyrus. And pre-central gyrus is the location. Pre-central gyrus is the location of motor area. Okay. So that is the correct answer. Also, if you will see the primary sensory area and that of primary motor area, they are also extending on the medial surface of medial aspect of cerebral hemisphere. Okay, so very important is to know the important area. So definitely you should know that if I am talking about area number 41 and 42, that is Hazel gyrus, that is auditory cortex, that is located in anterior transverse temporal gyrus. If I am talking about visual area, that is primary visual area 17, it is in the calcarine walls and floor, post calcarine walls and floor. So these are important. If I am talking about area number 44 and 45, that is the motor speech area. Area number 22 is the Wernicke's area, sensory speech area. Okay. So yes, now let's, yes, you are right that Beth cells also originates from this motor area. Now the next question is question number 10. Dilated and sphincter pupillae are derived from which germ layer? Surface ectoderm, neuroectoderm, mesoderm, neural crest. So basically, if I am talking about these are the muscles which is controlling the meiosis and that of metastasis of the people, and it is very important that they are getting its origin from that of which important structure? Neuroectoderm. Okay. So basically neuroectoderm, if I am talking about neuroectoderm, it is very important for you to know the other structures which are derived from these neuroectoderm. So these are primarily forming the retinal layers, retinal pigment layers, optic nerve, the posterior iris epithelium, and also the iris muscle, that is the sphincter pupillae and dilated pupillae. Now, for your examination, I just want you to also know about neural crest derivatives. Neural crest derivative, which is considered as the fourth germ layer. Here, there is a mnemonic for you to by heart the neural crest NCC derivative, that is called as CA motal as. CA motal as, C for craniofacial cartilages and bone, A for arachnoid and pia, M for the melanocytes, O for odontocytes, odontoblast, T for tracheal cartilage, E for enterochromaffin cells, L for laryngeal cartilage, and another A for all ganglia, sympathetic, parasympathetic, dorsal root ganglia, Schwann cells, and another S for spiral septum. So I want you to know about the derivatives of neural crest also and derivatives of neuroectoderm also. This is very important for your examination. Okay, now coming to the next question, that is question number 11. Which of these conditions will result if there is non-union of lateral nasal process and maxillary process of one side? Actually, why I am including this MCQ? Because this is an again favorite question for the NEET MDS examination, where you have to know about cleft lip, cleft palate, and what are the causes of it. So basically, if I am talking about non-union of lateral nasal process and maxillary process of one side, it will lead to the oblique facial cleft. Okay, oblique facial cleft. So you can see this diagram. This is a case of oblique facial cleft where there is non-union of lateral nasal process And basically, if the non-union of lateral nasal process and maxillary process occurs, the nasolacrimal duct is exposed out. Okay. Other abnormalities which you are seeing in A, B, C, D images is unilateral. So first image is unilateral cleft lip, which is due to non-union of medial nasal process with that of maxillary process. If the entire frontonasal process is not fusing with maxillary process, then it is a case of bilateral cleft lip. Also, if there is a developmental defect of the philtrum, then it is here upper hair lip, and if the two mandibular process are not fusing, then it will lead to cleft of lower lip. Okay, so it's very important that you should be knowing about the reason of all types of cleft palate and the non-union, and you should be also aware of images to identify. So if there is non-union of lateral nasal process and maxillary process, it's a case of oblique facial cleft. So I just want you to know about all types of cleft lip and palate. Now coming to question number 12, aneurysm of internal carotid artery within cavernous sinus will affect which of the following nerves first? So another important topic is cavernous sinus, which is very important for you to know. Actually, cavernous sinus is one of the dural venous sinuses. And the reason of formation of cavernous sinus is the splitting of two layers of cranial dura. So basically, we know that dura mater is made of endosteal and meningeal layer. So if there is splitting of endosteal and meningeal layer, it will lead to the condition of, condition of dural venous sinuses formed, and one of an important dural venous sinus is cavernous sinus. So basically, if I am talking about the structure which is passing to and fro in the cavernous sinus, we have got sixth cranial nerve and internal carotid artery. So the nerve which will be affected first is the abducen nerve, the sixth cranial nerve. Absolutely great answer, dear. Absolutely correct. Okay. Now, so I just want you to recapitulate the cavernous sinus. The blue color structure which is shown in this section is the cavernous sinus. And you can see medially, if we see the structures in the cavernous and medially, it is related with the pituitary gland, and it is related with sphenoidal air sinus. In the lateral wall from top to bottom, we have got oculomotor nerve, trochlear nerve, ophthalmic nerve. Okay. So basically, these three nerves are related. And in the another image I would like to show you. So basically, if we talk about mandibular nerve, maxillary nerve, it is not correlated, but it is very important for you to know that the third, the fourth, the sixth nerves are related. The ophthalmic nerves are related in the lateral wall. Also, inside the cavernous sinus, we can see internal carotid artery along with a nerve. And which nerve is this? This nerve is the sixth cranial nerve, the abducen cranial nerve. Okay, a very image is shown here where you can see the two structures which will be passing to and fro cavernous sinus is the internal carotid artery, but oculomotor, trochlear and ophthalmic. Now maxillary nerve is not considered to be related in the lateral wall. It is slightly lower down. Now let's see question number 13. Where can you palpate the artery? So this is an image based question in which you have to identify this artery. Okay, so this is shown on the temporal aspect of our face region. Okay, so this artery you have to identify. Then you have to tell me that palpation of this artery is done at which level. So actually, this is an artery which is superficial temporal artery. This is superficial temporal artery. And if I talk about superficial temporal artery, it is palpated at the root of zygomatic arch. Okay. So please see this another image. So this is a point of palpation of the superficial temporal artery, and which bony process is this? So if you will see this bony process is the zygomatic arch, and this is the zygomatic arch. So close to the zygomatic arch, at the preauricular point, we have got the area where the palpation of the superficial temporal artery can be done. Superficial temporal artery and maxillary artery are the terminal branch of external carotid artery. This is important. So basically, mastoid process, other points are absolutely wrong because these are not the area where the superficial temporal artery can be palpated. Now coming to the next question. Maxillary sinus opens at. So this is a question which is about, so basically lateral wall of the nose has got meatus, and you have to know the structures opening in the lateral wall of the nose, and you have to know which is opening at which level and where it is located. So that is very, very important for you to know. So maxillary sinus, if I'm talking on maxillary sinus, it's a most important sinus, and it's which is often infected, causing sinusitis. So maxillary sinus opening you will see in hiatus semilunaris, posterior part. So posterior end of hiatus semilunaris is absolutely correct, everyone. And I just want you to take a quick recapitulation of all the sinuses and important structures opening in the lateral wall of nose. So when we are seeing the lateral wall of the nose, what you can see, the area below inferior turbinate. So this is inferior. This is the cut part of inferior turbinate. This is the cut part of middle turbinate. This is the cut part of superior turbinate or concha. The area below the area below inferior turbinate is inferior meatus, in which we have got the opening of, nasolacrimal duct. In the middle meatus, there is an elevated area which is called as bulla ethmoidalis. So on the bulla ethmoidalis, we have got the opening of middle ethmoidal air sinuses. And if I am talking about the area which is lying below it, this area is called as, so basically if you are getting confused, let me just show you. This elevated area is bulla ethmoidalis, and below it we have got hiatus semilunaris. So in the hiatus semilunaris, from anterior to posterior, we have got anteriorly the opening is frontal air sinus, then we have got the opening of anterior, and most posteriorly we have got the opening of maxillary air sinus, which was asked in the question. And in the superior meatus, we have got the opening of posterior ethmoidal air sinus, and above the area of superior turbinate, we have got sphenoethmoidal recesses, and in the sphenoethmoidal recesses, we have got the opening of sphenoidal air sinus. Okay. Now, all are tributaries of internal jugular vein except. All are tributaries of internal jugular vein except. So we have got lingual vein as an option, middle thyroid vein, superior thyroid vein, and inferior thyroid vein. So if I am talking about tributaries, so which is the correct answer? So basically lingual, middle thyroid vein, superior thyroid vein, all are tributaries except inferior thyroid vein. Inferior thyroid vein is not the tributary of the internal jugular vein. Actually, inferior thyroid vein will drain into left brachiocephalic vein. It will drain into left brachiocephalic vein. Okay. Now, important tributaries has been shown here in the of that of IJV. We can see here. We can see the inferior petrosal sinuses, common facial vein, lingual vein, pharyngeal veins, superior middle thyroid vein, and ultimately they drain at the junction. As you can see, they ultimately we can see all important tributaries here. And if I talk about the tributary, that is, if I talk about inferior thyroid vein, it is actually it is draining into left brachiocephalic. Now coming to the next question, question number 16. Parotid duct open opposite to which of the following structure? Mandibular second molar, maxillary second molar, maxillary third molar, or mandibular first molar? So parotid duct, the other name is, it's also called as Stinson's ducts, which is traversing from the anterior border of parotid gland, and it will open in relation to the maxillary second molar tooth. Okay, question number 16, it will open where? It will open in the maxillary upper molar tooth. So see this diagram, you can see here the parotid gland from which the parotid duct anteriorly arises, Stinson's duct. It pierces the buccal pad of fat, buccopharyngeal fascia, buccinator muscle, and ultimately it opens in the around parotid papilla in the mucous membrane, and its drainage, it is draining serous salivary fluid, and serous its secretion is controlled via glossopharyngeal nerve, and basically which is via the tympanic branch of glossopharyngeal nerve, and that whole parasympathetic pathway you have to know. And parotid gland secretion is correlated with otic ganglion, from where from where the postganglionic fibers arises and secretion is controlled. It is actually secreted in relation to the upper molar, that is maxillary second molar tooth. Okay, my dear students, so done with this. Now coming to the next question, that is lingual nerve. So lingual nerve is a branch of anterior division of mandibular nerve, posterior division of mandibular nerve, maxillary nerve, or none of the above. So there are 4 options and you have to go with most correct answer. So lingual nerve. So mandibular nerve is another important topic in which you have to know about the branches coming from the trunk part, branches coming from the anterior division, branches coming from the posterior division. So lingual nerve is a branch from which one, dear? Ma'am, if both maxillary first and second is given, so which one to prefer? Answer. For which question? No, if you are talking about maxillary artery branches, I have already explained maxillary artery second part is giving muscular branches, Okay, lingual nerve is a branch. If I am talking lingual nerve, it is a branch from posterior division of mandibular nerve. All the students can join the Telegram group and absolutely they can ask anatomy related questions from me. So you are welcome for your doubts and I will reply your doubts in the Telegram group. Okay, definitely, don't worry. So if I am talking on one of the student was asking about second one. So if I am talking about the second part branches of maxillary artery, they are muscular branches. Okay, yeah. So Stinson's duct opening is parotid duct's opening is the second upper tooth, that is second molar maxillary. Maxillary is the maxilla is containing the upper tooth. Okay. Now I just want you to show this image where you can see the branches of mandibular nerve. So if I'm talking about the branches of mandibular nerve, it comes from trunk. So the trunk is giving yes, very good. Very good, dear. So trunk is giving, if I am talking about the trunk is giving 2 branches. One is the meningeal branch and the other, which is also called as nervus spinosum, and the other is nerve to medial pterygoid, which will supply medial pterygoid muscle, tensor tympani muscle, and tensor levi palatini muscle. So you can see nerve to medial. So if I am talking about nerve to medial pterygoid, tensor tympani, tensor palatini muscle, these branches, and nervus spinosum, these are the branches from the trunk. If I am talking about branches from anterior division, so anterior division is mainly giving motor branches to the muscles of mastication, lateral pterygoid, deep temporal, masseteric, and one sensory, that is buccal. So it is more of a motor. Anterior division is more of motor, and if I am talking about posterior division, it's more of sensory, giving the auriculotemporal nerve, the lingual nerve, and that of inferior alveolar nerve. Inferior alveolar nerve also gives one of its motor branch, that is the nerve to mylohyoid, which will supply mylohyoid muscle, and that of anterior belly of digastric muscle. Okay, my dear students, so you have to know about the branches of mandibular nerve. Now coming to superior parathyroid gland is derived from which of the following arch? Mesoderm of second arch, endoderm of third arch, mesoderm of fourth arch, or endoderm of fourth arch. So if I am talking about superior parathyroid gland, it's very important for you to note down that inferior parathyroid gland derived from that of third pharyngeal pouches endoderm, but superior parathyroid gland derived from the endoderm of fourth arch. Yes, absolutely right. D is the right answer. Now, all of you just go through the derivative. This is taken from Langman's embryology book. So this is the standard which you have to know about the derivatives of pouches. So first pouch derivatives are middle ear cavity. The second is palatine tonsil. And also from the first pouch there derives the auditory tube. And also if I'm talking about inferior parathyroid gland, see here it is derived from third pouch, and fourth pouch is forming superior parathyroid gland. Very important for you. Now coming to the next, muscles of mastication are derived in relation to which pharyngeal arch? First, second, and third arch. I want everybody to know very much detail of the pharyngeal arches and derivatives. You have to know about the cleft lip and cleft palate. So if I am talking on muscles of mastication, the masseter, temporalis, medial pterygoid, lateral pterygoid, they are all derived from the muscles of first pharyngeal arch. So here, this is a table in which you can just revise the muscles of second. So muscles of first pharyngeal arch is muscles of mastication, anterior belly of digastric. We have got tensor tympani and tensor villati muscle. If I'm talking about the muscles of second arch, that is the muscle of facial expression. Stylohyoid muscle, posterior belly of digastric. Anterior belly of digastric is the muscle of first pharyngeal arch. Third pharyngeal arch muscle is just one. Stylopharyngeus, fourth and sixth arch, the muscles are of, if I'm talking about fourth arch muscle, the muscle is of the cricothyroid muscle, intrinsic muscle of larynx, except cricothyroid is the muscle of the sixth arch. So please go through this table and by heart all the structures derived from the components of pharyngeal apparatus. Now, radio-ulnar joint is an example. I also want everybody to know about general anatomy joints, different type of joints and example. You have to know about the example of cartilaginous joint, example of synovial joint and fibrous joint. So basically, if I am talking about synovial joint, they are quite diarthrosis joint, they are quite mobile joint, and you have to know about the example of ball and socket, that is the hip joint, the shoulder joint, also the incus and stapedial articulation. And also if I talk about the fibrous joint, it is having not much of movement. There is sutures, hinge joint, elbow joint, ankle joint, and pivot joint is radio-ulnar joint. Superior inferior radio-ulnar joint is pivot joint, and also atlantoaxial joint is also a type of pivot joint. Okay, so A is absolutely right answer. Now coming to flux cerebri and tentorium cerebelli. So flux cerebri and tentorium cerebelli join at the level of which sinus? Flux cerebri and tentorium cerebelli are dural folds. Okay, and these dural folds are joining at a junction where one important sinus is located. The name of that sinus is straight sinus. So I would like to show you an image for it. So see here, in this diagram, you can absolutely see this. This is flux cerebri. This sickle-shaped fold of dura mater, which is separating right and left cerebral hemisphere, is the flux cerebri. And the tent-like fold. So other than, you can see the tent-like fold. If you will see the tent-like fold, this is tentorium cerebelli, which is actually separating the occipital lobe of cerebral hemisphere. This is tentorium cerebelli, which is separating and protecting the cerebellum from the occipital lobes of cerebral hemisphere. And at the junction of these two, I just want to mark, there is a sinus located. And what is the name of this dural venous sinus? This is straight sinus. So that was the question being asked. So the answer is straight sinus. Here also you can see the straight sinus is located, as you can see, in between the at the junction of flux cerebri and that of tentorium cerebelli. Tentorium cerebelli. Now coming to the next question. True statement about superior laryngeal nerve is all except. Superior laryngeal nerve supplies the mucosa of lower half of the vocal cords. Injury will damage the external laryngeal nerve. Injury to internal laryngeal nerve will also be anesthetized, pierces thyroid membrane. So if I talk about superior laryngeal nerve, my dear students, superior laryngeal nerve divides into two nerves, external laryngeal nerve and internal laryngeal nerve. So if I talk about the internal laryngeal nerve, it is giving innervation to upper part of the laryngeal cavity, lower part, lower half of the vocal cords, it is getting innervation from recurrent laryngeal nerve. So this is the wrong statement and the right answer. Now injury to damage of external laryngeal nerve can definitely happen if superior laryngeal nerve is injured, because superior laryngeal nerve is giving the branch external laryngeal nerve, which gives innervation to cricothyroid muscle. And as we know, internal laryngeal nerve is giving sensation to lower part of laryngeal cavity. And if I am talking about the nerve, internal laryngeal nerve, it is and superior laryngeal artery, it is piercing the thyroid membrane. So that all the other three B, C, D are correct statement except A. So I just want you to show this image where you can see internal branch of superior laryngeal nerve giving innervation to the upper part of laryngeal cavity. And this is superior laryngeal nerve, and its external laryngeal branch. If I am talking about external branch will give innervation to cricothyroid muscle as shown in the diagram. Okay, recurrent laryngeal nerve, as you can see in the diagram, it is giving innervation to all the muscles of larynx except cricothyroid, and sensory innervation to the lower part of laryngeal cavity. Okay, now coming to mid-diaresis of eye occurs due to dilatation of pupil occurs due to which of the following action of the muscle? Contraction of ciliary muscle, relaxation of ciliary muscle, relaxation of radial muscle of iris, contraction of radial muscle of iris. So you have to mark the most correct answer. Okay, so mid-diaresis means dilatation of pupil, and it happens due to contraction of radial muscle of iris. Okay, contraction of radial muscles of iris is the right answer, dear. Okay. Yes. Now see here. If I am talking about iris muscle, constriction of pupil is done. Constriction of pupil contracts causes meiosis, and its relaxation causes mid-diaresis. Dilator pupil, that is the radial muscle. Dilator pupil means the radial muscle. And this will contract to cause mid-diaresis. It will contract to cause mid-diaresis. So only I have marked this as the right answer, and its relaxation will cause meiosis. So same thing you can see in this diagram. So in this diagram, absolutely right. Absolutely right. D is the right answer, dear. And you can see when there is you can see this is the circular muscle and this is the radial muscle. So in this image, you can see the circular and radial muscle. And what I told you, when the circular muscle contracts, it will cause constriction of pupil and less light enters the eye. That is you can see the pupil will constrict. Dilatation of pupil occurs when the radial muscle contracts and the circular muscle relaxes. More light enters the eye and pupil dilates. So this is very important for you to know. And dilator pupil, constrictor pupils are derived from neuroectoderm. Now coming to next question. Anterior choroidal artery is a branch of which artery? Anterior choroidal artery, it's a branch of internal carotid artery. So I want everybody to know the branches of internal carotid artery. Common carotid artery, which will divide into internal and external carotid artery. This happens at the level of thyroid in the level of in between the C3 and C4 cervical vertebrae. And basically, if I am talking about the internal carotid artery, it gives no branches in the cervical region. It gives 5 branches in the cerebral region. Okay, it gives branches like superior hypophyseal, inferior hypophyseal, meningeal branches, and it gives 5 branches in the cerebral part. The 5 branches of internal carotid artery is posterior communicating artery, ophthalmic artery, middle cerebral artery, anterior cerebral artery, and anterior choroidal artery. Okay, so here you can see the branches of internal carotid artery is middle cerebral, anterior cerebral, ophthalmic, posterior communicating artery, and also it gives anterior choroidal artery. Yes, dear, why not B? Okay, with 22. No, ciliary muscle. Ciliary muscle, if if there is the option of basically it is related with the pupillary muscles. Okay, Ankit, pupillary muscles, no, constrictor pupillae and dilator pupillae. So we will go with the most correct answer as I have shown in the image also. Ciliary muscle is involved in accommodation reflex, but mid-diaresis we have to go, then we will go with contraction of radial muscle of iris. Okay, is it okay? You are confused with accommodation reflex in which 3 muscles are involved: medial rectus muscle and the ciliary muscle and also the constrictor pupillae. Okay, now coming to the next question, which cranial nerve nucleus lies underneath the facial colliculus? So if I am talking about facial colliculus, you can see the facial colliculus in the dorsal part of pons, and in the dorsal part of pons there is abducens nerve nucleus around which the 7th cranial nerve winding, that is called as internal jet. So underneath, if I am talking about underneath, the 6th cranial nerve lies. There lies 6th cranial nerve. Okay, so that is very, very important for you to know. Okay. Now, if I'm talking about the see here, this is the elevation facial colliculus, which is formed by abducens nerve getting surrounded by the facial nerve. Facial nerve is winding around the abducens nerve nucleus. Okay, abducens nerve nucleus. Here you can see this elevated area which you are seeing is the facial colliculus. This is the facial colliculus. Okay, I have explained. Okay, ma'am, cavernous sinus infections. Yes, cavernous sinus infections has got multiple route. Okay, either it can come through direct tributaries or like the superior ophthalmic veins are the common route. Facial vein, common facial vein, forming communication with the pterygoid venous plexus, emissary veins, and ultimately infection will reach the cavernous sinus. So, through its communications and through facial vein, superior ophthalmic vein, how it get communicated with pterygoid venous plexus and emissary vein, and ultimately the infection will reach in the cavernous sinus. Okay. Okay, so now coming to, so yes, I have explained about 24th. A is the right answer, dear. A. 7th. Okay, why not B? Which cranial nerve is lying underneath? They have asked. Okay, Vijay, they have asked which cranial nerve lies underneath facial colliculus. So facial colliculus is the elevation in which there lies 6th cranial nerve nucleus, which is surrounded by the facial nerve, 7th cranial nerve. 7th cranial nerve. So basically, if we are talking about underneath, the best answer will be the abducens nerve. Okay, best answer will be the abducens. Okay, done. Now 25th, which nerve is compressed by the aneurysma posterior communicating artery? Premaxillary. Premaxilla part develops from medial nasal process. Sine, medial nasal process or frontonasal process. Medial nasal process is the better one. Medial nasal process. Okay. Premaxilla develops from medial nasal process. Now, which nerve is compressed by aneurysma posterior communicating artery in circle of Willis? The right answer is oculomotor nerve. Yes, oculomotor nerve is the right answer. So you can see here we have got superior cerebral artery and posterior cerebral artery. In between we have got the third cranial nerve, and you can see third cranial nerve is closely related also by the posterior communicating artery. So third cranial nerve is the right answer. So just correlate with this image and you can see posterior communicating artery is there. Third cranial nerve can, if there is aneurysm of posterior communicating artery, the oculomotor nerve can be affected, leading to the paralysis of all extraocular muscle except lateral rectus and superior oblique. Now, I would also like to tell you about your target, that is the NEET MDS INICT 2026. For that, you can join the grand test series, which is very important. So the schedule of grand test series is INICT 22nd Feb. So you can see these are the test series which is going to take place, and all the timetable is there. So be the part of these test series on the MDS e-Gurukul app. It is highly beneficial for you to get a better rank in your. So again, there is a NEET MDS 26 All India mock test. So I just want everybody to be the part of these. So do register for the NEET MDS 26 All India mock test. So all of you can ask your doubts related to anatomy on the Telegram group. Stay connected. My blessings are with you. Important topics in embryology is the pharyngeal arches, apparatus, cleft lip, cleft palate, and also the development of palate and anomalies. And head and neck part is very important. The important muscles of mastication, TM joint, pharynx, thyroid gland, larynx, and also the cavernous sinus, dural venous sinuses are very important. The arterial supply is very important. So you should be, and all the cranial nerves, especially the 7th cranial nerve, oculomotor nerve. These are the most important. Hypoglossal nerve, tongue. These are the most important topic which you should not forget. And I have given the list. Also the parasympathetic ganglias are important. So I have given the list in the Telegram group. And if you want, I will once more give the list if anybody has not seen that list. Okay. Thank you. All the best. Keep studying. I will meet again. So my blessings are with you. Thank you.